Good morning, ladies and gentlemen, and welcome. We certainly thank you for taking the time to join us virtually. And with -7 on the thermometer in most places in Saskatchewan this morning, I think it's safe to say that summer is definitely over, unfortunately. I'm Gord Dobrowolski, and I'm the chair of the Saskatchewan Workers' Compensation Board. On behalf of the WCB, again, I want to welcome you to our preliminary rate information meeting. I'd also like to welcome you on behalf of your board members, Employer Representative Larry Flowers and Worker Representative Gary Hamblin. It is indeed my privilege to address you this morning. Our top priority is always the health and safety of our staff, customers, and partners. We urge you to follow Saskatchewan government guidelines on self-monitoring and self-isolation to protect yourself and your family. If you've been to a previous preliminary rate information meeting, you'll already know that we have a lot of information to cover. We'll have 30 minutes after the presentation for your questions, so please take notes and write down your questions as we proceed. The question period is open to everyone attending. When our CEO has wrapped up his final comments, you can submit your questions through our chat function, which should be on the right-hand side of your screen. Our moderator will read your questions, so please be sure to include your name as well. We will try to get all of your questions answered. If not, we will add responses and post our Q&A to the website. Later this month, the preliminary industry rate code specific sheets will be available on WCB's website. Each sheet contains specific rate code statistics and the 2022 preliminary premium rate. This annual meeting is part of our rate setting process, so we can remain accountable to you. This is also why we want your feedback on the proposed rates. We really do appreciate the time you've taken to be here and be a part of this meeting. Our vision at the WCB is to eliminate injuries and restore abilities. That's the foundation of all the work we do at the WCB. But we can only achieve this if we all work together. As employers, we all need to provide a safe workplace for your employees and have effective safety management systems in place. Cutting corners to save time or money could cost a life. Even small actions can have life-changing and devastating consequences. To illustrate the commitment we hope all business owners share, the familiar phrase, on time, on budget, which we've heard hundreds of times, should be expanded to say, on time, on budget, with no injuries. We believe that by adding those last three words, we are now covering every measure of success, including the health and safety of the people working on those projects. At the WCB, we strive to balance the needs of workers and employers. To achieve our vision, our mission is to be a customer-centric organization that continually seeks to add value for our customers through a culture of continuous process improvement. This means we are continuously improving our practices to deliver the best customer service possible. Last year, we implemented a paperless system for the 2021 rates. Just like last year, you could log into your secure WCB online account to view your 2022 premium rate statement, experience rate letter, and certificate if eligible. For rate codes with an increase of more than 10.5%, we will send out physical letters for those impacted employers in mid-October. Rate advice letters in December will continue to stay paperless. Having this information available to you online means you get the information quicker, and it helps protect your privacy. We are also taking steps to make our rate setting meeting more valuable for you, our customers. Today's information will be available online after the meeting. This is all part of our efforts to constantly advance our service to you. By the way, you can find a recorded copy of all our public sessions on our YouTube channel. Just search for the Saskatchewan Workers' Compensation Board on YouTube. As a board, it is our legislative obligation to guarantee the future of our compensation system. That means we need to be good financial stewards, even in the midst of the pandemic. During the pandemic, we took a number of actions to do our part and support Saskatchewan employers and workers through this difficult time. The WCB implemented a number of initiatives, including, and there's 4 of them. 1, COVID-19 injury claims received 100% cost relief through our occupational disease reserve. We provided more than $380,000 last year in cost relief related to claims from the COVID-19 pandemic. Number 2, we waived interest on unpaid premiums and removed penalties applied from April to July 2020 for late filing. We also removed penalties for late registration and underestimate penalties. 3, we offered payment plans for employers and suspended payroll audits for a time. And 4, we held the premium rate at $1.17 when the required rate, according to our rate model, was $1.23, providing more than $13 million in financial relief to employers. Canadians across the country continue to experience additional pressure, both at home and on the job, as our world continues to change and adjust to this ongoing pandemic. Things are evolving quickly, and there's a lot of uncertainty as to what the future holds and how long the pandemic will continue. This slide shows the average premium rate history. Under our rate model and considering claim costs and payroll, we calculated what the average preliminary rate would have been for 2022. We calculated the rate to increase to $1.25 based on projected payroll and expected costs for 2022 injuries. To help mitigate this increase in the 2022 preliminary average premium rate, the board will set the preliminary average rate at $1.23, which is below what the rate model is requiring of $1.25. This is the second year the board has adjusted the preliminary average premium rate. In 2021, the average premium rate was held at $1.17, below the required $1.23, to help provide financial relief to employers due to economic impacts of the COVID-19 pandemic on many employers. As you may recall, we have been advising employers since 2019 that they could likely expect to see increases in the Saskatchewan premium rates. Some other compensation boards in Canada have also released their 2022 preliminary average premium rates. Those that haven't will likely do so in the next few weeks. As you can see from this chart, Manitoba is proposing to keep their rate steady at 95 cents. BC is proposing to keep their rate steady at $1.55. The Yukon will keep their rate steady at $2.07. Quebec is proposing to decrease their rate by 10 cents to $1.67. Nova Scotia is proposing to keep their rate steady at $2.65. New Brunswick is proposing to decrease their rate by 48 cents to $1.69. Ontario is proposing to decrease their rate by 7 cents to $1.30. Newfoundland and Alberta will be announcing their preliminary 2022 rates in mid-October. Despite this year's increase, Saskatchewan's average premium rate is likely to continue to remain among the lowest rates in Canada, behind Manitoba and Alberta. However, our goal is not to have the lowest rate in Canada. Our goal is to uphold a balance between stable rates and a fully funded compensation system. Employers can influence their industry and individual premium rates through effective injury prevention, disability prevention, and return to work programs. Industry premium rates are also affected by the degree to which employers in an industry work to eliminate workplace injuries. After all, the least expensive injury is the injury that never happens. Individually, employers who commit to eliminate injuries in their workplace benefit from lower premium rates through the experience rating program. In 2020, 90%, that's 90% of employers achieve zero injuries and zero fatalities in the workplace. And this is up from 88%. So a sincere congratulations from the board to all of those employers. It's evident from this that Saskatchewan workers and employers are focusing their attention on safety efforts and creating safer workplaces in the province. A sincere thank you to all of you for your health and safety efforts. But we all know there's still a lot more work to do to eliminate fatalities, injuries, and suffering. Again, we must all remain vigilant to keep every workplace safe. The purpose of this slide is to help employers understand why you pay premiums. The workers' compensation system in Canada, as we know it, has been established through something known as the Meredith Principles. These principles were adopted over 100 years ago, and I believe they are still as valid and important today as they ever were. Reflecting on something known as the historic compromise, the Meredith Principles provide for an employer-funded compensation system in exchange for which workers give up their right to sue. The principles stipulate that the WCB will provide no-fault, mandatory insurance coverage to protect employers and workers from the impacts associated with workplace injuries. Through this no-fault system, employers are protected from legal action arising from a workplace injury and collectively fund the compensation system. Workers are provided benefits such as wage loss and medical. We remain committed to the Meredith Principles that protect families, employers, and entire communities. All of us here representing the Saskatchewan Workers' Compensation Board are extraordinarily proud to be able to help injured workers, their families, and employers when they are negatively affected by a workplace injury. So thank you for this. I'd now like to turn it over to the WCB's Chief Financial Officer, Crystal Nett, to discuss the balancing principles and disciplined approach to rate setting. Again, thank you this morning for attending.
Thanks, Gord. Good morning, everyone. We really appreciate your time and your attendance at our rate setting meeting. As Gord mentioned, I'm going to explain a little bit about the actual rate setting process itself. You can see on the next slide that we are always balancing rate stability and sufficiency. Premiums collected in the future must, over the long term, be sufficient to cover expected costs and expenses. The model must be fair and equitable for all employers, and the model must also be actuarially sound, meaning that the plan is sufficiently funded to meet its projected liabilities and to defray the reasonable expenses of its operations based upon commonly accepted sound actuarial principles. You may not be aware, but WCB has a legislative requirement to maintain the funding percentage within a range that is specified in its funding policy. So while rate stability is important, the system has to be sustainable. On the next slide, I'm covering the rate model balancing principles. And as you can see, there are 4 of them, and they actually comprise several elements in each principle. The premium rate setting principle should appropriately balance these sometimes competing principles. The rate model should provide for the security of benefits, be robust and sustainable, and it must satisfy the needs, goals, and expectations of employers while being actuarially sound, relatively simple, and easy to understand, communicate, and administer. Fairness needs to be balanced with collective liability. By fairness, we mean that premiums paid by current employers should cover the costs of their injured workers during the premium period. This principle covers intergenerational equity. In other words, current employers shouldn't be paying for claims costs that were generated by past employers, nor should they be subsidizing the claims costs of future employers. We also look at intra-generational equity, meaning that employer rate codes that incur injuries should be responsible for the costs associated with those injuries. So in a fair rate setting model, it encourages workplace safety and effective return to work policies by financially incentivizing employers' positive behaviors. Ford also mentioned collective liability, and that refers to the fact that employers as a group and those within the same industry are jointly responsible for all workers' compensation costs. Employers should not be excessively punished for unusually costly claims, however, so portions of those costly claims should be shared by all employers. Then we also have the principles of rate stability and reactivity that compete. Regarding predictability, employers should rely on a level of predictability and stability in rates, while at the same time we are balancing sufficiency. In reactivity, industry should expect quicker recognition of successful prevention initiatives and claims management practices. Industries with poor safety performance should also be recognized quickly. From a transparency perspective, employers should be able to understand the factors that went into setting their premiums, and the WCB should be able to clearly communicate this information to employers. On the next slide, you'll see that the key components of the rate model are quite inclusive. This slide summarizes the key components and then how they connect to the balancing principles that I just described. As you can see, most of the components impact more than one of the balancing principles. For example, both costly claim pooling and using an indicator to predict costs contribute to rate stability. This is offset, however, by the impact that long-term claim costs have on rate reactivity. And it's important to note that you can't pick and choose which component to use. All of them work together within the rate setting model to come up with our overall cost projection for the coming year. On this slide, where you can see premium rates in the middle, there's really two key drivers of the premium rate, payroll as well as claim costs. So the premiums that employers pay and then the investment income that WCB earns on those premium payments fund the overall workers' compensation system. And there are two components, as I mentioned, that factor into that calculation. The first component that drives the premium rate is employer payroll. Payroll is collected for all workers in all industries subject to coverage under the Saskatchewan Workers' Compensation Act. For claim costs, the costs associated with workplace injuries that have occurred in the past help us project what future claim costs will be. Premium rates are then set based on the ratio of claim costs to payroll. On this next slide, you can see what has been happening with overall payrolls within Saskatchewan and those industries that we cover. You can see the orange bar is projecting for 2022 that accessible employer payroll will increase by about 2% to 23.2 billion, up from the 2021 estimate of 22.7 billion. The pandemic has had an impact on the entire economy, but there are more pronounced impacts for certain sectors. This contributed to the overall relatively low estimate of a 2% increase. Beginning in 2020, the maximum assessable earnings are indexed with the change in average annual wage. Because we don't have the actual calculation yet, we have estimated a preliminary 2022 average annual wage of $94,174. This number is subject to change, and the final amount will be announced on our website once it has been received. As Gord mentioned, the rate setting meeting is being held 1 week earlier than historically, which explains the delay. And now I will pass things over to Jennifer Norleen Bytel, our Vice President of Operations, and she will talk about claim cost trends. Thank you.
Thank you, Crystal, and good morning, everyone. Overall, we are seeing an increase in claims costs used for the 2022 rate setting model. Healthcare costs continue to increase at a rate higher than inflation. There is research to strongly suggest that increased healthcare costs early in the claim are an investment in the future, as earlier medical intervention can lead to a quicker recovery. We know the longer an injured worker is off work, the more challenging it can be to get them back to work. This slide shows the overall cost increases from 2016 through 2019, which are the years that were used in the 2022 rate setting model. I will draw your attention to the fact that 2020 costs are not included in this chart. As you can likely imagine, due to the pandemic, 2020 costs were considered an anomaly, not reflective of typical experience, and therefore were not used for the 2022 rate setting calculations. Some of the reasons why the 2020 experience was significantly different are that there were fewer claims because of lower employment. We had injured workers receiving wage loss benefits longer because of challenges returning to work during the pandemic. Return to work options were limited or not available during parts of the year. Access to healthcare was disrupted, resulting in lower than expected medical costs. And the workforce in Saskatchewan changed significantly because not all industries were affected equally by the pandemic. While some industries were struggling, others were expanding. For example, the hospitality industry contracted while grocery stores expanded, and we saw wages and overall payroll increase in that industry. Incorporating this 2020 history into the rate setting model had the potential to reduce predictability and introduce more potential volatility at the industry premium rate level. Now that I've explained why 2020 history was not used for rate setting purposes, I'm going to shift back to what we see on the screen here. When we look at the years 2016 through 2019, primary drivers of increases in medical aid include increases in tertiary treatment programs, as well as costs related to psychological injuries. So tertiary treatment provides multiple services by an interdisciplinary team of healthcare providers experienced in the management of injury with permanent impairments and or significant psychosocial and pain management issues. When we look at compensation cost increases, serious injuries continue to be a concern and a significant contributor to these increases. Approximately 12.5% of claims are considered serious, and they account for 84% of compensation days and 79% of claims costs. We anticipate that serious injury claims will continue this upward pressure on the system, which is why part of our serious injury and fatality strategy includes a focus on the prevention of psychological injuries, which you'll hear more about from Kevin a bit later this morning. At this stage, I will now turn it over to our CEO, Philip Germain, to walk us through the evolving economic conditions and funding future costs.
For 2020. Am I on now? Very good. Okay. Thank you. So good. Just in case you didn't hear me, good morning, everyone, and thank you for joining us for our 2022 premium rate setting meeting. I'd like to start off by wishing you, your families, and your coworkers well. I hope that you've all managed to stay healthy and well during the pandemic, and I hope you all had a great Thanksgiving weekend. We've got a lot to be thankful for here in Saskatchewan. Despite some of the challenges, I think overall we're starting to go in the right direction. So this slide, I want to talk a little bit about the what. You've heard the what and a little bit of the why. So this slide shows the contributing factors to the increased 2022 preliminary average premium rate. As Jennifer pointed out, we purposely chose not to use the 2020 claims experience in establishing the 2022 premium rates. I want to be kind of make a clear point here. It's not because it would have resulted in a different average premium rate. In fact, plus or minus a penny, it was almost identical. But because we saw significant increases in compensation costs and reduced medical costs, as Jennifer pointed out, it would have reduced the predictability of the model going forward. So at the end, the overall costs were relatively similar as previous years, with a trend towards increasing. However, they were kind of flip-flopped in terms of what was driving the costs for 2020, having compensation lead versus medical. So those things changed quite a bit in 2020, and using the 2020 information wouldn't have really changed the overall premium rate, but it would have changed the predictability of the model going forward. So why did we decide to go with $1.23 versus $1.25? So it's not clear to us how long the pandemic will continue or what short or long-term impacts it will have on employment or benefit experience going forward. So due to this uncertainty, the full costs will not be passed on to employers at this time. Ongoing high numbers of serious injuries and fatalities that are typically high cost and increasing healthcare costs could put ongoing pressure on premium rates in the short to medium term. So let's look at the four factors or four main contributing factors to the increase in the average premium rate. The first one is lower than expected payroll. This is lower payroll, but it's really lower than expected payroll growth going forward. The forecasting process developed post-pandemic projections are based on pre-pandemic experience. So again, we didn't use 2020 because it's such an anomaly. So we used previous pandemic experience to project post-pandemic experience. We are projecting an increase in payroll of 1.9% from 2021 to 2022. The minimal growth in payroll is not keeping up with other inflationary costs like medical and average weekly wage. We are experiencing higher claims costs with limited payroll growth, which is ultimately what's leading to higher premium rates. As Jennifer pointed out, healthcare costs continue to increase at a rate higher than inflation. General inflation tends to be somewhere around 3 to 4%, whereas healthcare costs tend to increase at 5% or higher, sometimes as much as 9% in 1 year. And this trend is continuing. As per our act and policy, and I know Crystal had talked about this, but kind of hot off the presses this morning, is we do actually have just this morning the 2022, the projected average weekly wage for 2022. So as per our act and policy, we use the June revised average weekly wage to calculate next year's maximum wage rate. The Bureau of Statistics released the revised June average weekly wage yesterday, and the average weekly wage is $1,100.70, which means the 2022 maximum assessable and maximum wage rate for injuries on or after January 1st, 2014 will go up about 3.67% from $91,100 in 2021 to $94,400 in 2022. In addition, as been alluded to by Jennifer, or discussed by Jennifer, psychological claims costs continue to increase. Now, this is not a big surprise given everything that we've experienced through the pandemic the last couple of years. There is an increased frequency of psychological claims and their corresponding durations. A large portion of these claims come from industries with higher than average salaries. These 2 points help explain the increasing compensation trends and to some degree the medical aid trends. There are also fee schedules in place with general inflation increases that contribute to increased claims related costs. In summary, we're experiencing a similar number of claims that are accessing increasingly costly services. Our projected administration costs are also a factor. They're increasing less than 1% from 2021 to 2022, and almost all of that increase is associated with our negotiated collective bargaining agreement. Overall, the long-term trend towards a positive claims experience has flattened out. So we're seeing a flattening out of a reduction in injuries and injury rates, which we've been talking about for a few years now. And this is no longer offsetting those increases in healthcare costs and the increases in the average weekly wage. Now, there's been lots of encouraging announcements lately regarding large investments in Saskatchewan in the mining sector, processing, construction, infrastructure. And while the Saskatchewan economy appears to be improving, it is not yet translated into increased payroll being reported to us. Projected payroll and costs for 2022 has been a challenge this year. And in particular, we had a real challenge in trying to predict payroll in the R11 rate code. But thanks to the Heavy Construction Safety, or the Saskatchewan Heavy Construction Association, I'd like to thank them for providing some industry input and feedback in trying to figure out where that particular rate code is going. So in terms of funding future costs, as most of you know, the WCB has a legal obligation to be fully funded so that we can meet all of our obligations to employers and injured workers. The targeted funding percentage range is 105 to 120%. Investments have a large impact on premium rates because it's part of our business model. There are 4 key drivers that impact our funding and future costs that we are watching closely and managing to the best of our ability. Although we've had improvement in claims experience, it was primarily because of lower economic activity in the province and not necessarily because of lower injuries per capita. Those fewer claims did result in higher costs because more workers were kept on compensation instead of returning them to work in 2020. We have more costs with fewer premiums. Healthcare costs, as we've talked about, continue to increase at a rate higher than inflation. There is research to strongly suggest that increased healthcare costs early in the claim are an investment in the future. Psychological claim costs continue to increase. We've talked about this in a couple of slides. There's an increased frequency in psychological claims and their corresponding durations. And then overall, the long-term downward trend in claims experience has flattened out. This is no longer offsetting increases in healthcare costs and the average weekly wage. And projecting, as I said, payroll in 2022 was challenging. So the board is financially sound to absorb the cost increases in the short term, but cannot absorb the full amount or continue this practice over the long term. As stated in the 2016 rate model review, premiums collected in the future must be sufficient to cover expected costs and expenses. Given the changing economic environment, WCB's external actuary, sorry you guys, I'm just flipping my notes here a little bit. I got to get on the right notes. So we can't continue the practice, and I want to just go through these 4 bullet points really quickly and just add to the comments that I've just made. So although we've had improvement in the claims experience in 2020, it has been, like I said, primarily because of lower economic activity. So we're not necessarily seeing dramatic reductions in injury rates, but lower claims costs, or lower claims, but increased costs. As I talked about, our investment returns are a source of revenue for WCB, and this source of revenue offsets the premiums that we need to collect from employers. WCB relies on investment returns to discount premiums and cover certain costs within the system, like cost relief, our disaster reserve, and large capital investments like the business transformation program. As I've talked about, and Gord talked about, we have a legal obligation to be fully funded. Our funding policy has that range between 105 and 120%. But once we hit 103%, we are now obligated to replenish the fund back to a minimum of 105%, which could put additional financial pressure on industry and employers. Like I said, the board is financially sound to absorb some of the cost increases in the short term, but we can't continue to absorb the full amount or continue this practice over the long term. Given the changing economic environment, WCB's external actuary, Aon, has recommended a financial stability study. The scope of this actuarial study will be comprehensive and has been scheduled to start in early 2022. We held the average premium rate artificially low in 2021. By holding the rate at $1.17, as Gord mentioned, we're collecting approximately $13.4 million less in the 2021 premiums than what the rate model generated for required premiums. The premiums collected are not expected to cover estimated costs in 2021, which will result in a loss from operations and reduce the injury fund. WCB is also limited to the increases and decreases in industry rates to no more than 10% in 2021. As Gord mentioned, WCB provided more than $4 billion in cost relief for COVID claims in 2020, and so far in 2021, we have waived certain penalties, interests. We also waived certain penalties, interests, saving employers additional costs in 2020. Once again, this year we are artificially holding the rates down, which will save employers an additional $3.3 million in premiums. While these decisions negatively impact our overall funded position, we felt it was the right thing to do under the circumstances. While we are doing what we can right now to continue to subsidize premium rates, we are going to find ourselves, if we continue this, we're going to find ourselves in an unfunded position and are legislatively obligated to increase rates. And that's just passing off our situation to future generations. With the reduction in premiums, the funding ratio will remain above 105% as defined in our policy. While we're at 108% funded, while we were at 108% funded in early 2021, based on current data, the funding ratio is projected at approximately 107% by December 31st, 2021. This does not factor in the possibility of another major market downturn. Next slide, please. So as you can see from this chart, we're making a significant effort to keep the rates as low as we can while ensuring that we are fully funded and financially viable. This shows a 10-year graph of what our premium rates have historically looked like. We held rates last year to be a partner in the pandemic. We went outside our model in 2021 and we used a capping mechanism, which is not part of our model, so that we could limit rate increases in any particular rate code. We're at a point where we need to increase premium rates for the reasons I've outlined in the last slide. Despite these increases, we still expect to be among the lowest average premium rates in Canada. It's also important to know that our average premium rate includes a 5-cent component for safety associations. And these costs are only charged to 18 rate codes. They are not spread across all 50 rate codes. So this slide shows the 18 rate codes that I was just talking about that invest in and are members of 7 different safety associations. You can see the 7 listed there in bold. The safety associations, with support of a board of directors that is represented by workers and employers from these rate codes, submit an annual funding request to WCB, along with a strategic and operational plan to confirm how the funding that we provide will be spent to help reduce injuries and fatalities within these specific rate codes. The safety associations provide valuable programs and training to support employers and workers in these rate codes to help reduce injuries and fatalities. So that 5 cents is not really an average across all an average across all rate codes. It's really confined to these 50 or 18 rate codes. I'm now going to turn it over to Kevin Mooney, and he can provide us information related to the premium rates and injury breakdown. Thank you.
Good morning, everyone, and thank you, Philip. Over the next few slides, I'll provide a high-level overview of the rate setting process and provide a prevention update. The main objectives of the rate setting process are to ensure that the overall premium requirements of the WCB for the coming year are met. Premiums should cover all current and future costs for claims from employers operating during the year, including workers' compensation, voc rehab benefits, healthcare, survivor benefits, administration, and safety associations. The distribution of these revenue requirements across all employers is equitable. While maintaining collective liability, it should promote accountability and fairness and recognize injury prevention and disability management. The rate setting process involves 3 steps to determine an employer's premium rate. Number 1, industry classification. Number 2, establishing industry premium rates. And 3, experience rating, which considers an individual employer's claims experience. Next slide. Workers' compensation is a no-fault insurance system based on collective liability, where all employers share liability for workplace injury insurance. In other words, the total cost of the compensation system is shared by all covered employers. The first step in the rate setting process is classification, which is the process where similar employers are grouped together to form an industry rate code. Our classification system has 50 industry rate codes. Premium rates are set for each rate code based on the collective claims experience of employers within each of those rate codes. All employers within the industry rate code start off at the same industry premium rate. The rate model needs to strike a balance between fairness, where industry rate codes are responsible for the injuries they incur and the costs associated with those industries, and collective liability, where employers are not unfairly burdened by unusually costly claims, and a portion of those costs are shared amongst a larger group. The WCB is funded 100% by the premiums employers pay and the investments income earned from these premiums. Premiums that are collected in a year cover all costs of claims that happen in the year. So if someone is 15 when they're injured, we'll collect enough in 2022 to pay for the lifetime costs of that claim. Therefore, an actuarial rate model is used in the second step of the rate setting process to predict claim costs for the upcoming year. Setting and collecting premiums based on actuarial models promotes financial stability of the system and the security of the benefits. Costs include an industry's own claim costs, as well as their portion of any shared costs, which is the collective liability portion. Industry premium rates are really the costs divided by payroll. The last step in the rate setting process applies individual employer experience to the industry premium rate. Employers receive a discount for positive claims experience or pay a surcharge for poor claims experience. The experience rating program adjusts the employer's premium rate based on its individual claim experience and provides an incentive to influence injury prevention. If an employer's claims experience is better than industry, you're likely in a discount position. If worse, a surcharge position. Therefore, reducing the number and costs of claims through injury prevention and workplace safety can improve your experience rating and reduce the WCB premiums you pay. There are two programs in the experience rating program. The standard program is for smaller employers and the advanced program is for larger employers. The standard program applies to employers with less than $21,000 in premium paid over a 3-year period, and it's based on the frequency of time loss injuries. There's a maximum discount of 25% or a maximum surcharge of 75%. And this program applies to approximately 88% of Saskatchewan employers. The advanced program applies to employers with premiums of at least $21,000 over a 3-year period, and it's a cost-based program where individual employers are compared to others in their industry. If they are better, they'll receive a discount, which is a maximum discount of 30%, and if they are worse, they could receive a surcharge up to 200%. At the highest level, this slide breaks down the board level $1.23. Claim costs make up the bulk of the premium rate component at 67.5% due to the inflationary costs described by Jennifer earlier in the presentation. Admin costs increased account for about 23.6%, and the increase from 28 cents to 30 cents is due to our collective bargaining agreement obligations. Legislative obligations account for 5%, and this includes funding for the Workers' Advocate, the Ministry of Labor Relations and Workplace Safety, and the Committee of Review. And lastly, even though the safety associations account for 3.9%, this component only applies to 18 of 50 industry rate codes, and the average cost within those rate codes is approximately 15%, or sorry, 15 cents. My apologies. The pie chart shows the breakdown of the change from the 2021 rates to the 2022 rates. Overall, 95% of employers in 39 rate codes will see a higher 2022 industry premium rate, as depicted by the orange and gray slices. The orange slice comprises 87%, and the gray slice indicates 8% of employers in 4 rate codes will see an increase greater than 10.5%. The blue slice indicates that 3% of employers from 6 rate codes will see a lower 2022 industry premium rate, and the yellow slice indicates that 2% of employers in 5 rate codes will see no change to their 2022 industry premium rate. Over the next few slides, I'll talk about prevention and highlight that individual employers can do to influence their rate and speak to what the WCB is doing to influence the system on a broader scale. There are ways to influence and reduce your premium rates. Number one, by making sure you have an effective safety management system in place. And number two, by having a solid return to work program. The safety management system prevents injuries, and a return to work program assists with the injured worker's recovery. Prevention of injuries is the best way to control the premiums you pay to WCB, and WorkSafe Saskatchewan has a number of free online training programs available. In addition, the WCB's prevention department has resources to help you with your safety needs, and these services include training for occupational health committee members and supervisors, safety management system assessments, information on how to develop the elements of your safety management system or return to work program, and coaching employers on the review of serious injuries, which account for more than 80% of WCB costs. There's also 7 funded safety associations that work closely with our members of their industry rate codes to prevent injuries. Despite a consistent reduction in Saskatchewan provincial total injury rate over the last 10 years, there's signs that reductions in workplace injuries are starting to plateau. And research completed with other jurisdictions, including the Campbell Institute, highlight the opportunity to focus efforts on the reduction of serious injuries and fatalities as a strategy to further reduce workplace injuries and address the plateau that we're starting to experience. The Saskatchewan WCB definition of serious injury includes the following criteria, and there are 5 criteria. If it is a claim that is a fatality, a claim with more than 50 days of compensation paid, a claim that's reportable to Labor Relations Workplace Safety, which can include amputations, fractures, head injuries, neck injuries, or serious eye injuries. Number 4, if a claim is a primary psychological or mental health claim, and if a claim includes a permanent functional impairment greater than or equal to 10%. This graph on this slide indicates the total number of serious injuries in Saskatchewan workplaces on an annual basis. As you can see, there's approximately 2,500 serious injuries annually, and these numbers have remained relatively constant despite the reduction in time loss and no time loss claims during the same time period. Serious injuries account for approximately 12%, as Jennifer described earlier in the presentation. However, they do account for more than 80% of our costs. And as a result, there is a good reason to focus on these serious injuries from a business perspective. Our focus on serious injuries began in 2019 with the launch of our Fatalities and Serious Injury Strategy. And 2020 preliminary serious injuries are encouraging, with our 12-month rolling count below 2,300. In this slide, it's another reminder as to why we're shifting our focus. Every year, fatalities continue to take place in Saskatchewan workplaces, and they have a profound impact on workers, employers, families, and communities. As of August 31st, 2021, we have had 15 workplace fatalities in the province. 5 fatalities are related to asbestos exposure, 0 related to firefighter cancers, 2 are related to motor vehicle crashes, and 4 are related to COVID-19. Over the last few days, we've also finalized the September fatalities, with 1 worker found dead and 1 traumatic, where a worker was struck by a flying object. This is another reminder of the persistency of fatalities in Saskatchewan workplaces. Fatalities happen in many different industries. For example, fatalities happened in 39 of 50 rate codes from 2016 to 2020. And during that time frame, 45% of fatalities were related to occupational disease and 24% were traumatic. In 2019, WorkSafe Saskatchewan, a partnership with the WCB and the Ministry of Labour Relations and Workplace Safety, released a 3-year fatalities and serious injury strategy. WorkSafe has continued to implement initiatives outlined in the fatalities and serious injury strategy. The main areas of focus for fatalities include asbestos exposure, work-related motor vehicle crashes, firefighter cancer exposures, and falls from heights. WorkSafe's focus on the top 3 industries with the highest number of serious injuries include healthcare, transportation, and cities, towns, villages, and rural municipalities, along with a focus on first responders. Work in these focused areas include creating additional resources on the WorkSafe website, developing marketing campaigns, and working closely with employers and organized labor by creating partnerships with a common goal to reduce serious injuries. Progress related to this strategy is regularly updated every 6 months, and the current report is posted on the WorkSafe website at www.worksafesask.ca. The strategy is coming to an end in December 2021, and we're currently meeting with stakeholders to gather input as to what our next iteration of the strategy will look like in future years. As stated in the previous slides, we've had a consistent number of serious injuries and fatalities in Saskatchewan workplaces. As a result, the WCB launched a strategic initiative, which was our 3-year strategy to reduce serious injuries and fatalities. The 3-year strategy is now coming to an end, and part of that strategy saw that WCB's prevention department would work side by side with our customers to reduce serious injuries and fatalities. In addition, customer involvement in planning and implementing sustainable safety solutions to mitigate serious injuries and fatalities will be well established as we work to develop and implement our stakeholder engagement strategy. In 2022, we will complete our stakeholder meetings and develop our next strategy. We'll begin working on new initiatives within this strategy and identify new opportunities with stakeholders and where stakeholders can lend expertise and support. Work continues on a collaborative consulting approach to work directly with our employer community. Last year, we worked to help employers identify and address the root causes of serious injuries, and our next focus will be working with employers to do effective hazard assessments in their workplaces. As we continue to work with employers on root cause investigations, there's also the opportunity to further develop external partnerships to help address the root causes of these injuries. We're also in the second year of a 3-year partnership with Dr. Jody Samra, a registered psychologist, and she's been helping us with a long-term psychological health and safety strategy. This strategy includes the development of a resource center, which we launched last year on the WorkSafe website, and it's got a number of materials to help you and business owners in creating and enhancing your mental health programs in your workplace. These resources will help you protect the mental health and safety of your employees. And again, these resources can be found at www.worksafesask.ca. In 2022, we will work on a 3 to 5 year strategy, and we look forward to seeing many of you in our stakeholder sessions over the next several months. I'll now hand the reins back over to Philip to walk us through the long-term outlook, and thank you.
Thanks, Kevin. So just to reiterate our messages from the last few slides, improvement in claims experience due to lower economic activity is not necessarily reducing injury rates per capita. Investment returns have a large impact on premium rates as part of the WCB's model. It pays for reserves like our disaster reserve, occupational disease reserve, second injury and reemployment reserve, and a discount rate on premiums. The WCB has a legal obligation to be fully funded, and the targeted funding percentage range is 105 to 120%. And the board is financially sound to absorb some of the cost increases in 2022, but cannot absorb the full amount or continue this practice in future years. So with every challenge, it creates an opportunity to do something good and meaningful. As we look forward, we remain focused on the key opportunities as well as the challenges and risks that could prevent us from achieving our strategic and operational plans. While vaccination rates are improving and the economy appears to be picking up, there are related challenges, and there are potentially new unknown challenges related to the pandemic that could continue to negatively impact our economic recovery, like labor shortages and disrupted supply chains. Regardless of whatever curveball the pandemic throws at us, we will continue to work to support psychologically safe workplaces that are resilient and more capable of dealing with change. We believe focusing on psychologically safe workplaces is a key to not only preventing injuries and preventing disability, but it will help us get through this pandemic. We're taking steps to reduce the impact of market volatility by diversifying our investment portfolio even further. We've taken a number of steps to diversify our investments over the past few years, and we continue this work. Recognizing that no one is completely immune to volatility in markets, despite our best efforts to maximize returns while reducing risk within our investment portfolio, we are not completely immune to large and sudden reductions in the market, which can dramatically reduce our funded position. We will undertake an actuarial sustainability study in 2022 to help us determine whether or not we are in fact on the right path for long-term sustainability and viability. We are investing in our business transformation program, and I'll elaborate that more in a few minutes. Over the past few years, we have noticed a long-term trend where approximately 12% of our claims represent about 80% of our costs and 80% of compensation days. The best opportunity to manage the potential negative outcomes associated with workplace injuries is A, working together to prevent them from happening in the first place and focusing on the prevention of serious injuries that significantly impact people's lives. And B, working together to prevent disability by making sure that we do everything we can to help people rehabilitate and return to work. So from a long-term outlook perspective, we're looking at the sustainability study, staying focused on our strategic plan that is centered around the voice of the customer. I'll talk about that in a second. And then trying to anticipate and forecast where rates will likely go over the next year or two. So as it relates to the sustainability study, the scope of this actuarial sustainability study will be comprehensive and has been scheduled to begin in early 2022. The sustainability study helps the board understand the framework needed to steer our ship in the right direction over the long term. It may also help with rate stability, but it does not directly help with reducing claim costs or premiums required to cover those costs. The study should help us meet our long-term obligations and outcomes and ensure policies are in place to maintain or improve fairness in the system. As it relates to our strategic plan, assuming that nothing was to change, we will likely see increases in premium rates. However, there is a strategic plan. Our strategic plan is meant to minimize the impact of the factors that are pushing premium rates upward by reducing serious injuries and fatalities and improving rehabilitation and return to work outcomes. We'd like to thank LRWS, all the employer associations, safety associations, and labor organizations for helping us develop the original fatality and serious injury strategy, and who are working with us again to update and improve the fatality and serious injury strategy. Our plan is to continue to revisit the strategy with our customers and stakeholders to study it and adjust it so it is continuously improving outcomes. We're also working on developing a new model for disability prevention and return to work. This 3 to 5 year plan should help stabilize or maybe even reduce injury-related costs. Assuming our plan is successful, we could see the pressure on premium rates reverse within the next few years. This plan will require partnerships and the support from employers, workers, employer associations, safety associations, and labor organizations. Working together, we can make the changes necessary to improve the system for workers, employers, care providers, and our staff. So going forward, based on what we're currently seeing in the rate model in 2021 for 2022 premium rates, it will not be a surprise if we see an increase in the 2023 premium rates. Having said that, we are aggressively working on our strategic plan and are hoping to see some gains made in 2022. As a result of the risks and opportunities we are facing as an organization, we were able to confirm through an independent review in 2020, and with those opportunities and risks confirmed through this independent review done in 2020, we formally launched our business transformation program in early 2021. This program is aimed at transforming every major aspect of our organization as it relates to people, processes, and technology. Taking a program approach means we can advance a series of integrated efforts or projects where transforming how we serve our customers is looked at from an enterprise perspective, so that interdependencies and efficiencies can be identified early and integrated into our planning and execution as much as possible. This approach will prevent a series of one-off projects in multiple business areas that are implemented without fully understanding, for example, how a change in an operations process might impact a process or an outcome downstream or with another part of our business. Program approach also prevents us from implementing multiple technology solutions in different parts of our business, where sometimes those systems don't talk to each other, or without significant overhead, or where there are limitations leading to frustrating workarounds that make it difficult for our staff and customers to access accurate information in a timely way. The WCB's Business Transformation Program is the start of a transformation that will change how we serve our customers and see the organization invest, like I said, in the processes, structures, and technologies that will enable us to better serve you, our customers. We anticipate this being a 5 to 7 year journey where together we will work to reimagine how we deliver our products and services across all areas of our business, and then make the changes needed in a way that is sustainable and respectful to our staff and our customers. The end result will be better service for our customers through enhanced service delivery, improved processes, and improved technologies. We believe that this will create a series of wins for workers, employers, partners, and our staff. One of the major objectives of the Business Transformation Program is to transform our customer service at WCB. Going forward, the vision of the WCB's customer service delivery model will be to provide a service that is more proactive and focused on following customers' needs from the first interaction through to the final interaction. Many areas, including our support areas, have developed targeted operating models that will guide this journey towards better service and better outcomes. In developing these targeted operating models and the goals and objectives of this program, we have reached out to our customers more than ever to get their voice and their input in our processes and the outcomes that they're expecting. To assist with this, we are going to need to modernize our core technology, in particular the technologies that enable claims processes, employer services processes, and our finance functions that are embedded in these areas, like payments and premiums. We will also be looking for opportunities to modernize some of our enabling systems, like finance, content management, human resources systems, and introducing or enhancing offerings such as mobile apps, improved web portals, and better data and analytics. As Jennifer alluded to earlier, we have worked with and will continue to work with our customers and staff to clearly articulate and realize the benefits of our business transformation program. If you'd like to learn more about our business transformation program, please reach out to us via askwcb@wcbsask.com, and we will have someone follow up directly with you. So what's next? So during the October time frame, obviously the information on preliminary premium rates will be shared. We're expecting the individual rate information sheets to be provided around October 22nd. From there, employers will have 30 days to provide us feedback. With rate increases that are above 10.5%, they will be published in the Saskatchewan Gazette. Those employers affected by these changes will also receive a letter advising them of the increase. The letter will also include their preliminary 2022 firm rate with experience rating applied. Our practice is to provide employers with the 30 days to provide feedback, which is important to us, regarding premium rates, and where we welcome your feedback within this time frame. In particular, as I mentioned earlier, one of the real challenges for us this year was trying to predict where payroll is going. So any feedback in that regard would be greatly appreciated. In November, all the feedback that is provided to the board, and the board uses this feedback to approve final premium rates. In December, employers will receive their rate letter with their premium rate for 2022. Ensure that your business has a WCB online account for early access to your premium rate notice. We're targeting hopefully around December 7th is where that information should go out. As I said, industry rate sheets will be available on our website, and we are anticipating on or before October 22nd to have those individual industry rate sheets available. WCB resources are available if you have any questions. If you'd like more industry discussion or more information about where your industry premium rates are going or your specific employer premium rates are going, we have several account managers within our prevention department that are available, and you can reach out through to the prevention department to arrange individual meetings and get more explanation on where your industry and or specific premium rates are going and why. And just a reminder, the information presented today will be available on our website at www.wcbsas.com and on our YouTube channel. You just have to search Sask Workers' Compensation Board in YouTube, and a number of videos, including this one, should pop up.